Hi guys, welcome back to Biohacked. I'm Amanda.
And I'm Nadeem.
Before we begin, did you catch last week's episode on homeopathy? If you haven't done so, make sure you head over to our YouTube channel, and also make sure you check out our Instagram for the big giveaway that we have going on with Boiron Canada.
Today's episode is all about Nafld,
which stands for non-alcoholic fatty liver disease,
a condition in which fat builds up in your liver that is becoming more and more prevalent and is often undiagnosed in many people regardless of weight. NASH is a type of Nafld in which one has hepatitis, inflammation of the liver, and liver cell damage, in addition to fat in their liver. In biohacking, optimal health is connected to the liver. The liver does 500 to 600 jobs a second, and it cannot complete these jobs in the presence of Nafld or NASH in the body, and it simply has a harder time optimizing.
Today we chose to talk about NAFLD and NASH because quietly they have both reached epidemic proportions. There is no simple test currently available for the diagnosis of NASH or NAFLD, and disease-specific treatments have not yet been approved. The stats on NAFLD are, by 2030, we are estimated to have a 65% increase. The number of liver cancer and liver transplantation related to NAFLD is said to be increased by 100%. People with normal body mass index who are metabolically unhealthy have a prevalence of NAFLD at around 7% in North America. That means if you are fit and skinny and in shape, you could possibly still have a fatty liver. As a matter of fact, in my private practice, more and more, I'm encountering fatty livers in children as young as 2 years old. Lack of clean diet and exercise are no longer the sole causes of a fatty liver.
A new causation that has appeared in the last 10 years is the herbicide ingredient glyphosate. Herbicides are used to kill undesirable plants or weeds, and pesticides are chemicals that may be used to kill fungus, bacteria, insects, plants, or weeds. 75% of the glyphosate usage has occurred in the last 10 years.
A recent study was done where rats were fed 0.1 parts per billion of glyphosate for 2 years. After 2 years, they showed signs of enhanced liver injury, as indicated by anatomorphological and blood and urine biochemical changes. The rats grew a fatty liver in 2 years. Glyphosate can uncouple liver mitochondrial oxidative phosphorylation. Oxidative phosphorylation is the process in which ATP is formed. ATP is produced in our mitochondria by the energy from the food that we eat. If the mitochondria is the powerhouse of our bodies, ATP is the energy currency needed to run those powerhouses. Ingesting chemicals such as glyphosate can rupture or disengage these enzyme systems and lead to metabolic disorders. Some examples of metabolic disorders are cancer, hormonal imbalances, skin issues, diabetes, heart issues, and high cholesterol. So here are 4 of our personal suggestions to optimize the liver.
Drinking reverse osmosis or distilled water. In these types of filtered water, the glyphosate is removed. You can purchase water meters that will test the parts per million of your water. Optimal ppm range is between 0 and 10. You can eat organic produce. Keep your staples such as garlic, onion, rice, and wheat organic as well.
Drain and support your liver. In my private practice, I do a lot of work with fatty liver and glyphosate through biotherapeutic drainage and clearing the blocked enzyme systems in the mitochondria. If you want to know more, you can check out my website. Also, avoid drinking commercial-grade coffees and teas as they are often the most heavily sprayed crops with glyphosate.
Here are our clinical and therapeutic recommended supplements that will help to not only prevent, but drain a fatty liver.
First, you start with under 243 and 44. Draining a fatty liver can often have a die-off or something we refer to as Herxheimer reaction, which is also known as a healing crisis. So before moving to herbals, I highly recommend using these drops at 10 drops 3 times a day. For a more deeper pathology, a gemotherapy is recommended. It is a deeper acting remedy, and very often it is best prescribed by a practitioner. Seeing a practitioner that's trained in auricular medicine and biotherapeutic drainage is heavily recommended over self-prescribing.
Once you have drained the liver, you need to reestablish the enzyme system by clearing the mitochondria and the nucleus, using oligoelements discovered by Gabriel Bertrand, a French chemist and biologist.
Oligoelements are bioavailable forms of trace minerals that are rapidly absorbed. These bioavailable elements work by normalizing and reestablishing the enzyme and hormonal functions in order to regulate the homeostasis of the body and ultimately our cells.
Finally, we move on to the herbals after draining and reestablishing. The herbals will work to support and maintain.
Two of my top recommended brands are Live Complex and Silymarin from Soroil. Live Complex is a blend of 6 powerful herbs including milk thistle, rosemary, and dandelion. And finally, Silymarin, which is 80% milk thistle. I personally recommend either MediHerb or Soroil. They are triple batch tested brands, which means that they are tested before, during, and after formulation, and especially tested for contamination with glyphosate toxicity. This is extremely important in your supplements because even natural crops can become exposed to glyphosate. Thanks for joining us on today's episode. Make sure you hit that like button and leave us some comments below.
Don't forget to stay tuned for our giveaway and for our next episode. Please follow us on Instagram and subscribe to our YouTube channel, Biohacked, by clicking below.